It's Dr. Robert Strang, Chief Medical Officer of Health. Today we're announcing 5 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 127. Until now, most cases have been connected to travel or a known case. However, public health has reached a point with one of our current cases where no direct links to travel or a previously known case can be made. We now have to come to the conclusion that at least in this specific case, it's the result of transmission within a community in Nova Scotia. I just want to talk a little bit more about that case. We know that the individual that involved was at an event on St. Patrick's Day. We were going under the thought that perhaps that was a source of exposure, but as we've investigated that event, everybody who has been at that event is now past their 14 days. Nobody's become sick. All their tests were negative. So we have to come to the conclusion that it's a good one, that there was no risk of exposure of anybody, no transmission of COVID-19 at that St. Patrick's Day event. But we're left with the conclusion around this one individual that they were exposed somewhere else, and because of their specific history, that exposure could only have been somewhere here in Nova Scotia. This isn't unexpected, confirming community transmission. There may be other cases of community transmission, and we certainly will get more. What it does is further strengthen the need for every Nova Scotian to strictly adhere to public health orders and directives. This is how we will minimize any further spread of COVID-19 within Nova Scotia. Practicing good hygiene, maintaining a physical distance of 2 meters or 6 feet from others as much as you can, especially when out and about. But having said being out and about, we want to limit our travels. We should be at home as much as possible, only do essential shopping, and only have one person in a household doing that. Limit gatherings to no more than 5. And it's especially important that the people understand that gatherings, even though we've said there can be up to 5 people, those are only for essential gatherings. Now is not the time to get together, even in small groups, just because you'd like to. It's important that people get together outside of their household only if they need to, and if you do need to get together in no more than 5. Even this weekend, still hearing some reports. I've had a couple of emails today, people concerned about what they're seeing in terms of groups of people getting together, even though they may be respecting the social distancing. Certainly where I live in Fall River, our Tim Hortons is a very popular spot in springtime for motorcyclists. They were out there yesterday, Sunday, with their Tim Hortons, large numbers of them, standing within 6 feet of each other. We have to understand that the way we will minimize the impact of COVID-19 in Nova Scotia, the way we can prevent or minimize its transmission is by following the rules. And a key rule is staying apart from each other, staying at home as much as possible. If people are happy with that, and I acknowledge that it causes a lot of disruption, but the way we can get out of this as quickly as possible is to actually stick very closely, all of us, to the rules now. That will allow us to resolve the situation and to start to loosen off the public health requirements as soon as possible. If we're not following the rules, the disease will just keep going on and on and on, and we'll be in this situation for a lot longer and need to have strict public health measures for a lot longer. People may have heard that the Nova Scotia Health Authority issued a release today about a case of COVID-19 associated with a restaurant in Elmsdale. That restaurant was allowing only takeout, but there may have been an exposure at that restaurant in March 23rd, 24th. Public Health has done its follow-up. Most of their close contacts have been identified, but they have public released just to alert anybody else in the community who may have been at the restaurant in specific times, and if they have been, as the steps they need to take. Unfortunately, I'm hearing that there are people are blaming this restaurant or targeting the restaurant because of this. People need to understand that when we do these public releases, it's simply to inform individuals in the community that they may have been exposed at a certain place or an event. It is not at all meant to target an individual, a group, or a location. It simply is where potential exposure may have happened. I just want to end by updating. People are aware we talked about COVID-19 in 3 long-term care facilities yesterday. in 2 of those long-term care facilities. All the tests that have come back so far have been negative. I misspoke a bit yesterday. I thought in the R.K. McDonald facility in Antigonish that all of the tests had come back, and I said that happened and they were all negative. There are a small number of tests still outstanding for some of the staff in that facility. Those are being tested today. But so far in the R.K. McDonald and the Shanix facility in Dartmouth, all of the tests are negative. We unfortunately do have a third long-term care facility in Enfield where we have 2 residents and 2 staff members who have tested positive. Public Health is working very closely to support that facility in further investigating anybody else who may have been exposed. We are bringing, EHS now has a mobile testing capacity that has been brought out, and we'll be testing as quickly as possible all the staff and all the residents in that facility. And appropriate residents who are test positive will be isolated along with the 2 that we know are positive. Any staff will be sent home. If their tests are positive, they'll be isolated for as long as they need to be until we can clear them from the disease. We appreciate that this situation is creating a lot of staffing challenges in this facility, and both the Nova Scotia Health Authority and the Department of Health and Wellness are actively working with that facility to ensure that we have the necessary levels of staffing to provide essential care to all the residents. So we have seen some firsts here today in Nova Scotia. Our first case of community transmission, the first cases in long-term care facility, that we expected these to happen, but the main message for Nova Scotians is that this disease is here, it's serious, and we need to pay serious attention to all the public health orders, all the public health directives, that we all need to do these carefully, working together, caring for each other, building community, not tearing apart community while we do that, using common sense to do the things that we all need to do to minimize the chance of spreading the disease from one to another.